Thank you very much, Chairman sir, the respected faculties, Professor Mandal sir, Dr. Kunal sir, and all the dignitaries and my friends and colleagues for inviting me to this CME. So I will be speaking on, with the introduction of the lifestyle medicine and also the problem which we are facing because of the current lifestyle. It may be lifestyle disorder, or we can also known as a non-communicable disease, and how to counter that using different physiological technique. And also I will be touching upon the concept of the lifestyle medicine, the concept of the performance medicine, the concept of the sports and exercise medicine, and most importantly the concept of exercise as medicine, how exercise can be used to counter this disease, to not only to prevent it but also for the treatment and rehabilitation purpose. So can you please connect the slide? ओके, तो थैंक यू वेरी मच. हाँ, ये थोड़ा ढीला हो गया शायद. Yeah. So I think now it's working. So exercise is medicine, prevention and treatment of different disorder of the lifestyle. I am Dr. Hanjabam Barun Sharma, sports and exercise medicine specialist, clinical and interventional physiologist, and I am currently the General Secretary of Indian Society of Sports and Exercise Medicine. So let's begin the talk. I will be talking under different heading, like for example, how to identify the problem which we are facing, like for example, the disease of the different disease of the current lifestyle, and what are the root causes. And after understanding the root causes, let's see how we can counter that by using the physiological intervention. Then I will be speaking about the exercise medicine, the challenges which we face, in order to practice the different the physiological intervention, and also the scientific way in which exercise can be prescribed and targeting the different physical fitness component. And I will be talking about the muscle-centric medicine, countering the negative effect of the visceral fat, and I will be talking little bit about how to target say diabetes and hypertension and other diseases if time permits. So lifestyle disease is the problem. What we are facing is lifestyle disease is not the disease where drug deficiency is there. So lifestyle disease means we have to counter by using the different lifestyle intervention, not by giving a different drugs. So medicine is not the answer. Drugs are not the answer. The answer is the changes in the lifestyle, because that particular disease is because of the lifestyle. If you want to correct, if you want to change that particular disease, counter this, you have to correct your lifestyle. So that is the message, because you cannot drug the particular person into being more healthy. You have to invest into health, you have to do exercise, you have to do healthy, adopt the healthy lifestyle. You cannot just take one pill and become more healthy. And you cannot blame upon the genetics also, because genetics may load the gun, but the trigger is pulled by your lifestyle. So epigenetic is very important. How to maintain the healthy lifestyle is important, because 90% of the illness which we are facing as a lifestyle is because of our stress and a lifestyle, not because of your genetics. Genetics may have that underlying condition, but that it can only be converted into that particular disease because of the epigenetics. So that's why we have to understand what are the different etiology, what are the different causes of this lifestyle disease. And one of the most important causes is physical inactivity. Physical inactivity has been described as a pandemic since 2009 and 2012. And cardiorespiratory fitness, low fitness level, different type of fitness I will be talking. Low fitness level is one of the most important risk factor for any non-communicable disease. And you can see that, since 1965, so much reduction has been done there in case of the regular physical activity, be it a leisure physical activity, transport related, domestic, occupational related. So a gross reduction in physical activity is there. So we have to see, and if you see the Indian context, India is fifth among the South Asian countries regarding physical inactivity, and 15.6% of adults are physically inactive. And this physical inactivity is very important because this is one of the root causes of so many problems, be it as a cardiovascular problem, be it a muscle related, that is sarcopenia, be it a
central nervous system problem, the cancer related, it may be a metabolic problem, it may be, musculoskeletal related problem. So physical activity has lots of problem is there. So if you want to target that particular, different disease, you have to target the root cause. That root cause is a physical.
like, for example, Pakistan and India, where how it is there. That means, as compared to the Western population, we have South Asian phenotypes where we may have lower BMI. Because you cannot just suppress the symptoms. You have to, if you want to cure that particular thing, you have to target the root cause. And the root cause is mainly, biochemical basis. If you understand, then hyperinsulinemia is one of the most important root cause. And the leaky gut syndrome is also there, where autoimmune, as a non-communicable disease is high, and the chronic inflammation. And you can see that all three can be effectively targeted by maintaining an optimum lifestyle and the fitness. Because if you see the insulin resistance, it may be caused by many various factors, including the sedentary behavior, including the processed food and everything. And it has lots of problem. For example, sarcopenia, stroke. It can lead to type 2 diabetes and everything. So inflammation and this insulin resistance, insulin, you are not in the face of the type 2 diabetes. But insulin hyperinsulinemia may be a problem. So if you want to target you cure all this problem, including the cancer, then the prevention, you have to make sure of this insulin resistance and the chronic the inflammation. So 80%, more than 80% of the individual, if you see, general population, they may be having a high instance of the insulin resistance, and it may be more than 50% in India also. And if you see the metabolically fitness, you don't focus not only on the physical fitness but also the metabolical fitness, and these are all different parameters which can we easily measure in any kind of the physiological lab, and we can see whether a particular person is physically metabolic fit or not. And you can see that the triglyceride level is very important. Triglyceride is more important than LDL cholesterol and total cholesterol. So these are the concept where we can target the insulin resistance. And further, if you want to go into the biochemical physiology, you see that the insulin resistance, cortisol, and because of the inflammation, lots of paper has been published, lots of citation is there, and these are the root cause. You have to target this root cause. It may be lipotoxicity in the form of the ceramide, lots of medicine, and that particular medicine may cause another symptoms which optimum health, because the doctor you understand this is the Kishanganj or he said that if he said 150 people with heart transplant, but if you focus on a genetic care, then one could himself. This is the first person to the heart the transplant. So, the sign of the good doctor is not that particular patient on drugs. He is the good doctor who remove the drugs, who remove the requirements in drugs by making that particular fit. Yeah. So a best doctor is the one who's preventing the disease from ever happening. And the great doctor is the one who treat the patient. So just become the best doctors. And in order to become the best doctors, you have to understand the concept that the body itself heals naturally. The only thing is you have to remove the causative factor. The causative factor which I've already spoken. So that causative factor can be removed by using positive lighter, not by using say statin or the Ozempic or the other drugs. They may remove the symptoms, but the root cause, the primary cause, may still be there. So that's why a physiological concept is important, where the targeting of that particular patient care is the base of the pyramid is formed by the lifestyle intervention or physiological intervention, where we use different intervention, like for example we use the optimum nutrition, exercise, sleep, stress resilience, meditation, mental health, yoga, and all these things can be used under the heading of the clinical and interventional physiology. This is the definition which we give in the paper, and not only for the health and the fitness promotion, but also for injury and in this prevention, treatment, and rehabilitation. So different, the branch of the medicine has started, like for example, functional medicine has recently started. They tends to focus on the root cause by using different intervention, including the supplement and also the lifestyle medicine with the different pillars. And if you see the pillars of the lifestyle medicine, where what are the pillars? Like for example, nutrition, physical activity, stress, coping, social connection, they're avoiding the risky behavior. Everything is there. So if you want to target that particular lifestyle disorder, then you have to touch upon all these pillars. And if you want to go above the normal, then you have to go into the performance medicine. The performance medicine is where all the concept of the lifestyle medicine is there under the physiological and the psychological tool. In addition to that, you have to focus on the technical and the tactical that is required for obtaining DOF-free performance optimization. Injury and illness-free, DOF-free performance optimization under the heading of the performance medicine. And in the performance medicine, sports and exercise medicine is one of the branches where we focus not only on the treatment, but also on the physiological. That means Citius, Altius, Fortius. You want to achieve that optimum performance. Not only we not only focus on the treatment and rehabilitation, but on the enhancing, stretching the physiological limit. So sports and exercise medicine is basically sports medicine and exercise medicine, where sports medicine we generally deals with the optimum human performance enhancement. And exercise medicine is where use of the exercise as a therapeutic intervention for treatment, rehabilitation, and prehabilitation of different injury and illness. So sports medicine, we generally focus not only on the sick patient, but also on the elite athlete. Elite athlete. That means from sub-physiology to normal physiology to supra-physiology. So all this domain we have to see, and this is a definition of the sports and exercise medicine which we give, in the recently published paper. And what we require is always, exercise and physical activity not only for the health, fitness and promotion, but also for the medical and therapeutic use. Use of the exercise, use of the sports as a therapeutic, as a medicine, for optimizing health and performance. So that is the concept of the sports medicine. Why sports and exercise medicine is important? Why exercise is important? Because the answer lies upon the evolution. Because we as a Homo sapien, we evolved in the plain of the savannah by using what is known as persistent hunting. So movement is a medicine. If you don't move, if you are physical inactivity, you are basically against the evolution. The brain, the development of the brain is said to be, the produce adaptable and complex movement. So if you don't have the movement, then brain will not have been developed. So that's why it is very important, and a different fossil records are there which says that our ancestors, they were hunter-gatherer and a persistent hunting. We were evolved as a runner. So that's why movement is very important. And movement is not only important for the whole body, it is also important for your mental health, neurological health. And lots of mechanisms are there. I will not go into the detail. Like for example, BDNF is increased because of it causes a neuroprotection. Neuroplasticity has been increased. Cognition is increased. The depression and all that particular mental health problem is decreased. So exercise is one of the most important factor for mental health. It may be in some cases it may be equal to the medicine of the different drugs which we are currently using for anxiety and depression. And lots of biochemical messenger are there. It has been published well, and the point is, because of the different concept, it may be aerobic exercise, it may be resistant exercise, it may be concurrent exercise, combined exercise. Everything affects your brain. So not only your physical health is improved, your mental health is also improved. So that's why we says that exercise is the most underused antidepressant. Food may be the most abused anxiety drugs. So we have also done different documentary regarding the exercise and the brain health. And the simple prescription of, say, aerobic exercise, like for example 3 to 5 times in a day, 70% to 80% of your heart rate reserve, say just 30 minutes of your day, may improve your signs and your symptoms of the mental health. So this one has to understand. So exercise not only improve your brain health, but also it involves whole system. It is the one things which you do which affect the entire body. entire cells. So exercise is, that's why exercise is known as medicine. It may affect not only the metabolic health, insulin resistance, metabolic health and everything is improved, but also the cardiovascular health, but also inflammation. Remember the 3-4 root causes of non-communicable diseases which I talk. They are all targeted by exercise. So exercise is so much important that the exercise 30% reduction of all-cause mortality can be achieved by you doing a regular exercise. It may be, for example, bone fracture can be reduced, fall risk of the falling in the elderly can be reduced, sarcopenia can reduce, dyspnea can reduce, sarcopenic obesity can reduce, coronary problem can reduce, colorectal cancer, prostate cancer, breast cancer, all this, can be effectively targeted by using exercise. And if you compare the exercise with different drugs, the different medicine which we are having, you can see that the different papers are there where you say that exercise is more beneficial, as compared to the even anticoagulant. If you see regarding the stroke, see, exercise is more this thing, and exercise is also comparable for coronary heart disease and for also the heart failure and everything. So exercise is well known the thing, and the problem is we don't use it. The doctor don't use it. The medical health profession do not use it. Exercise, lots of paper has been published. Like for example, 88% survival at 12 months is for, there for exercise in case of the coronary artery disease. 40% reduction in cardiac disease. Type 2 diabetes, 58% reduction type 2 diabetes. It may be superior or even equal to the drug or surgery in some case, but unfortunately, we don't use it. So the reason may be many things. One of the reason is they don't know, the medical health profession do not know how to use exercise properly as a treatment. That's why American College of Sports Medicine, they have launched this exercise medicine globally in 2007. And in India, we are planning to launch this exercise in is medicine in India very soon, where we have to educate the healthcare professional how physical activity can be assessed, for fitness can be assessed as a part of your clinic, and how exercise can be used as a therapeutic intervention. So exercise is very important. Every mortality can be reduced by using exercise. Like for example, if you do both aerobic and strength training, then see how much reduction of hazard ratio is there in case of the say lower respiratory tract infection. For cancer also, it is reduction is the all-cause mortality can be reduced. Everything is beneficial. So not doing exercise, not doing a simple walking an hour is considered to be high risk behavior now, because so much beneficial effect is there for exercise. Mortality of the cardiovascular disease is reduced because of the exercise. If you see the osteoarthritis also, how osteoarthritis is becoming very common, especially among the females because of the weight problem. If you see a regular exercise, then there is much reduction in the hip as well as knee osteoarthritis, and also loss of the cancer also directly related: colorectal cancer, breast cancer, endometrial cancer, kidney cancer, bladder, and all the stomach cancer. They are directly affected by exercise. So this the concept one has to understand. That's why the Robert Butler has says that if exercise could be packed in a pill, then it will be the most prescribed and beneficial medicine in the whole world. So that's why this is the beauty of the exercise. Not only exercise, also sports is also a medicine. Like for example, football is a medicine. Football can be used as a medicine. You take football, you take kabaddi, you take cricket. Any sports event can be met as a medicine if properly given. It can be used to target the say type 2 diabetes, cardiovascular disease, osteoporosis, and the risk of falling and everything. So that's why. But what is the challenge? Challenge is people don't want to take the lifestyle problem because they just want to do surgery and pills. That's all. Shortcut. हर कोई को shortcut चाहिए रहता है. Everyone wants shortcut. They don't want the lifestyle change. The change. That is the problem which we are facing. It may be because of different, because money may not be there. When you're sick, then money may be there. If it is not here, it is not here. But the problem is, if you see the healthcare spending, if you see the spending and a life expectancy, it is not linearly related. That means, like for example, USA has spent lots of spending on healthcare, but their life expectancy is not more. That means if you spend lots of money in the sick care, then your life expectancy may not be that much high also. So something is wrong because we are targeting wrongly, spending is wrongly targeting in that particular the sector where That is not the root cause. Like for example, like 50%, more than 50% of that particular your habit, your lifestyle, your exercise, everything is the causative factor. But we are focusing 88% on the sick care, not the health care. Pathology-centric approach is being followed rather than the physiology-centric approach. So if you, and another problem is we as a doctor are not fit at all. If you are having a central obesity and you prescribe nutrition to that particular patient, how will they do it? If because the general public also see that a young doctor with a fit doctor, they say that it is an inexperienced doctor. If you see a huge central obesity, they say, see, senior hai, experience hai. So that concept has to change. So everything has to start from you. So regarding again the sports, coming back to the sports and exercise medicine, in the sports medicine what we do is exercise training has to be done. So how we have to target that problem? That problem can be targeted by using a scientific approach to training and prescription. Like for example, exercise training of how scientific approach we have to follow, and regarding the exercise prescription also what we have to follow scientifically, because we want to focus not only on the health but also for the performance, and we want to stay away from the pathology but focus more on the physiology. Illness and injury reduction with the dose-free performance optimization. That is the answer. And optimum cardiovascular health is what is required. Focusing too much, having too much high intensity exercise, we want to avoid the sudden cardiac arrests which are happening in the gym and everything. That we have to focus. A balance has to be approached, because optimization of risk-benefit ratio is very important if you want to prescribe that particular thing. Because that a Goldilocks zone where optimum amount of the exercise, optimum amount of the a particular major nutrient, like for example carbohydrate, that has to be followed. Excessive is never good. And just seeing the concept of the exercise training, like if you do too much of the acute exercise load as compared to the chronic load, for example, if you do acute means just 1 week before the before your session, if you do exercise, that considered to be the acute. And if you do 1 month, that is the chronic. That means chronic means your fitness. So if you don't focus on the fitness, if you suddenly do too much, then what will happen? Danger zone. That is, injury can happen during the exercise training. That's why too much too soon after, too little for too long, that is dangerous. We have to start low and go slow. So that mantra we have to follow. And regarding the extreme exercise hypothesis also, like for example, if you do high intensity exercise for a very long time in harsh condition daily, then exercise will not have that beneficial effect. That goes from the most beneficial zone to the most dangerous zone. So extreme exercise hypothesis is also there. One has to understand, because if you do too much high intensity, then a little bit hazard ratio can also increases. And cardiovascular mortality can also increases for a short time. In fact, for coronary heart problem can also increase if you do daily exercise for a very high intensity. That's why you have to understand how much is too much. So that thing one has to understand. Just like precision medicine, where medicine is prescribed based upon the requirement, based upon the individualization principle. You have to do exercise prescription, exercise training on individualization principle. You cannot just say कि आप जा करके 30-minute walk करके आओ. That is not the scientific way. You have to write, you have to prescribe in a proper way, and for that exercise training principle, one has to understand, like SPORT, sporty. Specific exercise has to be specific, because specific demand to the adaptation to the imposed demand happens. So if you are not specific, then your goal cannot be specific. It has to be progressively overload. You have to challenge your physiology by giving adequate rest. Then only the adaptation can happen. And reversibility, if you don't give adequate stimulus, then what will happen? The gain will be lost. Then variation, it has to be vary. Otherwise, injury and illness can happen because of the monocytic, because of the overtraining syndrome, because of the, say, the overload. And individualization, very important. Each and every person is different. That's why you have to tailor that particular exercise based upon that particular intervention. And SMART goal one has to follow. Like just giving you an example, during the competition phase in the athlete, we generally increase the technique training, but we decrease the volume of the training. Otherwise, what will happen? Overtraining problem can happen. So that's why the variation has to be done based upon the scientific principle. Similarly, if you are, seeing a particular patient of the non-communicable disease, then you have to prescribe the exercise based upon the scientific principle of the fit. Like, for example, frequency. You have to say how many times a week or how many times a day you have to prescribe the exercise. How much is the intensity of the exercise? How much is the duration? What is the type of the exercise? What is the volume of the exercise? And the progression. If you give an exercise, one static, then you are not challenging your system. If you don't challenge the system, then adaptation will not happen. That's why progressive overload principle has to be followed. So by using this principle, you can follow different, like, for example, resistance training, flexibility training, balance training, aerobic training, what you call the proprioceptive training can be given based upon this, the principle. But not go too much into technicality also, because if you go too much into technicality, then the patient may not receive also, because one has to understand any exercise is better than no exercise at all. Something is always better than nothing. So you should prescribe an exercise that he or she has to do it. That doing is more important. And exercise should be celebration of what your body can do, not an punishment of what you add. So that is also important. So that thing one has to understand. And regarding the intensity of the exercise, how much intensity you have to prescribe, just 2-3 points you have to remember. If a particular person is able to sing and talk, then that is a mild intensity exercise. If a particular person is able to talk but not able to sing, that is a moderate intensity exercise. If he is not able to talk at all, then that is high intensity exercise. So high, low, moderate intensity exercise you can prescribe. If you want to go into technicality stuff, you can go into the different technically, like by using the heart rate monitor, which are markedly available. You can prescribe the different exercise intensity, which I will not go into the detail. So for the practical point of view, this is this is a simplified diagram which we prescribe. Like, for example, percentage of maximum heart rate, 57, 64, 77, 96, 96. That is how we remember. If it is less than 57, then it's very light. More than 57, less than 64, it is light. In this way, and for example, for resistance exercise, 30, 50, 70, 85, 85. If it is less than 30% of your maximum weight, which you are able to lift once, then it is the very light exercise. That is known as 1 RM. RM means repetition maximum. 1 means only one time. If you are able to lift that particular weight only one time by maintaining all the form, then that weight is your maximum, 1 RM. So 1 RM can be, a percentage to 1 RM, we can prescribe the rest and exercise. So SMART goal has to be followed. It has to be realistic. It has to be specific. If you are prescribing exercise to a marathon runner, then it has to be different from a sprint runner. So that one has to understand. And realistic goal has to be, and time bound and more attainable goal has to be there. Otherwise, the particular person will not be able to follow. So that's why a behavior counseling is also very important in case of the lifestyle clinic or physical activity clinic or exercise clinic, where you have to assess the problem, you have to advise according to the problem, you have to agree what are the changes which has to be done. You have to assist that particular patient or subject, how he can do it. You have to provide everything in writing. Prescription, exercise prescription is very important. And if he or she need, then you have to assess it and you have to arrange that particular thing for him. That is important, because you have to change the thinking from pre-contemplation. That means no intention to change, to action. No intention to change, then you make it to he or she does that particular exercise. And you maintain it and you avoid a relapse to the particular behavior. So pre-contemplation, contemplation, preparation and action, these are the behavior therapy technique which we have to follow in order to provide the sustainable exercise prescription. And in order to go into the specifics, we have to understand the different fitness also. Why this is important? Because each exercise can target each component of the fitness. Like, for example, cardiorespiratory fitness, body composition, muscle strength, endurance, flexibility. So each component has to be targeted. Whether it is a health related, more into lifestyle medicine, or whether it is a skill related, more into the sports medicine component, performance medicine, where we target the different agility, coordination, balance, power, reaction time and everything which is required for that particular performance enhancement. So this has to be deal into that particular taken taken into consideration in order to design that particular exercise. So that's why we have to understand. So let's focus on the cardiorespiratory fitness. Cardiorespiratory fitness is very important not only for the player but also for the general people. Like for example, say if you see the comparison of the diabetic, this is a diabetic, this is a non-diabetic, you can see that the VO2 max is very, very low in case of the diabetic, and that low diabetic, it is still there if you control for the differences in the body composition and body percentage body fat. That means the fitness may be low, cardiorespiratory fitness may be low in diabetic because of he or she is having more obesity. But if you control that differences still, the cardiorespiratory fitness is low in case of diabetic. That's why the fitness is more important than fat. Fit is more important than fat. The person may be having a little bit of adipose tissue, but he may be more fat. So that is one has to understand. So our aim should be targeted on improving fitness, not on weight. Weight is the minimum. We should focus on the body composition, not on the weight. And this is just another thing where you can see the HbA1c, and this is the VO2 max. You can see that, the lower inversely proportional. That is, HbA1c will be more in case of the less fitness. So fitness is very important, not only for the maintenance of the glycemic control and everything, and for also the cardiorespiratory fitness in case of the, mortality. You can see that the inverse proportional is there, both male and a female. That means for every increase in metabolic equivalent, that is metabolic equivalent is quantification for exercise, you can see that cardiorespiratory fitness increase, then you can 11.6 reduction in all-cause mortality happens. So that's why the fitness is very important. In case of the patient also, that is important. That is, cardiac rehabilitation is also like clinical exercise physiologists we have to target. And you can see that as compared to the high cardiorespiratory fitness with the low cardiorespiratory fitness, 58% reduction in mortality can happen. All-cause mortality can be reduced by 68%. So that's why not only for the athlete, not only for the type 2 diabetes, not only for the healthy people, but also for the person who are already suffering from the cardiac problem is very important. Like dementia also, 90% reduction in dementia can happen if you have a very high fitness. So what else you require? So fitness is very important. Why this is important? Because the fitness, cardiorespiratory fitness, target three things. One is your respiratory system. Respiratory system, exchange of gases happen, your cardiovascular system, heart, and your muscle system and mitochondria. Three important things here. That's why fitness is very important, cardiorespiratory fitness. The more cardiorespiratory fit you are, the more fit will be your three system. That is your cardiovascular system, lungs, and muscular system. That is one has to understand. And you can see that for a sport player is also important. Like for example, if you see the more high fitness, this is the high fitness. And you can see that reduction in injury happens if you have a more fitness. 51 to 5.6, that is maximum aerobic speed. If you have there, then reduction in injury happen. That means injury prevention also, fitness is important. These are the different papers which we have published in hockey players and everything. And not only cardiorespiratory fitness, but also muscle fitness. Like for example, 69% of sports injury can be reduced if you have a strength training. That is important. And similarly, injury can be reduced if you have a lower body strength. If the more lower body strength, the less will be your injury risk. That's why fitness is very important. These are again the different papers which we have published in this target. And that's why muscle is also not very important. Not only target your cardiorespiratory system, but also the muscular system. Why this is important? Because after 40 years of age, decline of muscle will happen. That is, the sarcopenia will happen. Up to 1%, 1 to 1% of the percentage of the muscle mass can be lost in a year. Or your muscle strength, that is 3% can be lost. That is known as dynapenia can happen. And it can only be prevented by doing an exercise with adequate protein intake. Resistance exercise, adequate protein intake, these are very important if you want to prevent that sarcopenia. Why this is important? Risk of fall. This is the definition of muscle-centric approach which we have used. Muscle-centric approach is a physiological intervention where we use optimum evidence-based exercise with the lifestyle and the nutrition. Nutrition means adequate protein intake. Because see, after the age of 65 years, 33.3% of fall will be there in 1 year. It will increases to 42% after 70 years. 90% of the hip fracture, may happen because of the fall, and 20% is fatal. How you want to prevent that? You have to, you can prevent that by doing exercise. Exercise and nutrition, because reduction is there not only in the muscle mass but also the quality of the muscle. Type 2 muscle fiber decreases. That's why muscle is known as the organ of the high longevity, whereas fat is the organ of inflammation. So you have to reduce the fat, you have to increase the muscle. That is important. And also similarly for females, menopause, osteoporosis, very important, because decline will happen after the 40 years. 0.5% per year of bone mass will decrease. How you can target it? Bone mass, if you can target during your pre-teen age, that is pre-puberty, if you target that particular child by doing an adequate impounding activity, jumping activity which challenged your bone system with adequate nutrition, then you can have you can counter this decline. So that's important, because obviously we always focus on fat. We always forget the muscle. Muscle is also very important. Muscle-centric medicine is very important. Target the fat also, but don't forget the muscle, because for longevity, 3 things is very important. Your thigh muscle mass, your hand grip strength. Muscle mass is very important. Not only your heart and lungs, but also muscle mass is important. That's why metabolic flexibility, for metabolic flexibility and overall health, muscle should be targeted. And muscle is important not only for your general health, but also your cognitive ability also. There is bi-directional relationship between your muscle mass and your cognitive health. So it can easily be measured by using say walking space, grip strength, the appendicular lean mass. We can easily do in our lab. So that's why very important. And for metabolic health also it is important. If you see the insulin mediated glucose uptake, even for an elderly, that is black is the elderly population, if you are an athlete, your insulin sensitivity much higher as compared to the obese. That means for metabolic health also muscle is very important, and hand grip is very important for cardiovascular mortality. Even it is said to be more important than your blood pressure. Simple hand grip strength, if you can do easily in your clinic, it is very much important. And why this is important? Because in India we are facing this central visceral obesity. I have already focused. Yes, central obesity hota hai, a South Asian Indian phenotype, where and the proportion of the pre-diabetic and diabetic may be because of this reason, where the fat is deposited in the viscera, that is known as TOFI, toffee, fat inside, thin outside, fat inside, thin outside, fat. You look thin from outside, but all your fat is deposited inside. That is more dangerous. This is why we are facing, because this is if your fat is more inside your organ, then you are more metabolically problem. And this visceral fat, that is known as visceral fat, central obesity. Visceral fat cannot be targeted by your diet. You cannot just do dieting and just remove the fat. Dieting may be required for other problem, not for visceral fat. For visceral fat, you have to add exercise. If you do exercise and nutrition, then your increased rate of the visceral fat, VAT, visceral fat adiposity is there as compared to the diet. So that one has to understand. And for visceral fat, which type of exercise is very important? High intensity interval training, sprint interval training, aerobic and resistance training, very important. For moderate to vigorous intensity, these are important. Like for example, 3 times a week for 3 to 4 months of say 30 to 60 minutes of exercise can be helpful if you want to target your visceral fat. Why visceral fat is important? Because visceral fat is the one who is causing the problem. They are highly inflammatory. Chronic inflammation, it can rise. Just taking an example of your fatty liver. You know that 10 years before you develop type 2 diabetes, your fatty liver has started. It is known as the scream, silent cry of the liver. Your liver cry 10 years before you develop the type 2 diabetes. This is very, very important. This is known as a long silent scream from the liver. And if you see the fat content is very, very high, then your whole body insulin sensitivity is very low. That's why this visceral fat, removal of visceral fat is very important. And for reduction of this visceral fat, exercise is very important. I have already spoken, not only this nutrition, but exercise is very important. Simply by doing say 150 to 240 minutes per week of at least moderate to high intensity exercise can remove 2 to 4% of absolute fat reduction from the liver. So that one has to understand. And in addition to the aerobic exercise, you can add the resistance exercise also. So going into the diabetes, if you see lifestyle intervention with metformin is the most commonly drugs we use in diabetes. It is comparable in case of the elderly population. That means metformin, diabetes is more effective. And if you see the metformin reduction, 31% can be reduced by metformin. But lifestyle intervention, type 2 diabetes risk can be reduced by say 58%. So by just adopting a 150 to 175 minute of physical activity, you can reduce the type 2 diabetes up to say 70%. And for every kg weight loss, 16% type 2 diabetes reduction can be done. And also mortality is also reduced, both for type 2 and type 1 diabetes, mortality reduction is there. So when you see the comparison between the exercise and metformin, exercise has lots of beneficial effects which metformin may not have. And if you combine metformin with exercise, then many of the chronic adaptation of exercise may be lost. This one has, like for example, simply say VO2 max. Aerobic fitness is increases by exercise, but metformin doesn't do that. So there are lots of things which exercise can do, but the metformin doesn't do this one. One has to understand. And for type 2 diabetic, we have to monitor the glucose by using an ideal CGM, that is continuous glucose monitor. This Eliab Kipchoge, we in sports science also, sports medicine also, we use CGM for monitoring the thing. Why this is important? Because 120 gram per hour of glucose can be utilized in case of the chronic exercise, which may lead to hypoglycemia if you are taking say exogenous insulin in type 1 diabetes. This one has to understand. But if you are doing high intensity exercise, the liver can pull up 10 times your glucose. That means hyperglycemia and ketosis can go in type 1 diabetes. So that's why you have to understand. For aerobic exercise, blood glucose can decrease, but for high intensity and anaerobic exercise, blood glucose may rise. So you have to take all this into consideration before prescribing exercise to type 2 diabetes. Like for example, a single aerobic exercise up to 72 hours, insulin sensitivity is maintained. That is LOPE, that is late onset hypoglycemia can last up to 24 hours. That one has to understand. If you are doing say late night exercise, then you may have say late night hypoglycemia, especially in type 1 diabetes. So you may have to take certain glucose also. And what is the rule of thumb? We generally use the rule of thumb is 15 to 20 gram of glucose every 1 hour. We generally prescribe in case of the type 1 diabetes if you want to do exercise. And if the blood sugar is more than 250 plus ketone, do not do exercise. If the blood sugar is 300, stop, don't do exercise. What is the ideal blood sugar before the exercise? It is 180. 120 to 180 milligram per deciliter. That is the practical tips which we use in case of the prescribing exercise to diabetes. There are lots of different things which I don't want to take into consideration. But the main point which I want to say that, for example, if you want to prescribe aerobic exercise by using the FIT principle, frequency how much? 3 to 7 days per week. Intensity, how much? 40 to 59% of your VO2R. That is, VO2R is the VO2 reserve. Or say for type 1 diabetes, 150 minute per week. Type 2 diabetes, 150 per minute of moderate to high intensity. This thing can be used. Rest and exercise you can do, like for example, 3 to 4 times a day. So this thing one has to understand. So not only for diabetes, not only for type 1, type 2 diabetes, hypertension also, exercise is a medicine for hypertension. But before prescribing exercise for hypertension, you have to do certain things which one has to understand. For example, if your resting blood pressure is more than 200, don't do exercise, khatam. If it is diastolic is more than 120, do not prescribe exercise. If your exercise hypertension during the exercise is more than 200 by 115, don't do it. If the rise in your diastolic blood pressure is more than 15 millimeter mercury, stop the exercise. So there are lots of integrate which one has to understand. Like for example, Valsalva maneuver, like breath holding should not be done if you are doing a resistant exercise in case of the hypertension. Otherwise, what will happen? Your retinal problem may happen. So these are the tips which one has to use before exercise is prescribed for hypertension also. But it is very effective. If you see, compare the exercise with the drugs also, which are different drugs are used for hypertension, you can see that the exercise can decrease the systolic and diastolic pressure up to 8.78 milligram. millimeter of mercury. 8.96 millimeter of mercury. Exercise can, sometimes the reduction by exercise is more effective as compared to the certain drugs also. But naturally, one comes, which type of exercise? कौन सा exercise देना चाहिए? Which type of exercise is more important? Recent has said the isometric exercise, simple by doing a isometric hand grip exercise, you can reduce your blood pressure up to 8.2 millimeter mercury for systolic and 4 millimeter mercury for diastolic. It is resistant exercise is more effective as compared to your aerobic exercise. We generally prescribe walking, but we forget the resistant exercise. In case of the hypertension, resistant exercise is very important, especially the isometric resistant exercise. So these are the integrate which one has to understand. And regarding the obesity and overweight also, we exercise can be an effective medicine in order to maintain that particular weight loss which is achieved by doing a hypocaloric diet. Like for example, weight loss can be say 0.5 to 1 kg per week of weight loss is allowed scientifically. If you are losing more than that, then you are not losing fat, you are losing water. Water. So these are the different things which one has to understand. Our aim should be 10% weight loss in 3 to 6 months, not more than that. Otherwise, you are losing lean muscle mass. So if you are doing hypocaloric diet, you are losing weight, but that weight is muscle mass. That is not healthy. If you are doing hypocaloric diet plus adequate protein, you can reduce that lean muscle mass loss. If you are doing hypocaloric diet plus adequate protein plus aerobic exercise, you may limit the loss of your muscle mass. But if you are doing resistance exercise along with that, hypocaloric diet plus that adequate protein, you are maintaining your lean muscle mass. You are increasing your lean muscle mass. So that is the funda which one has to understand. So I am summing all the points which I have spoken into a more integrated approach. Dr. Gagan will be speaking the diet control. So chronomedicine, chrono exercise, maintaining, aligning with your circadian rhythm is also important. Like for example, you should not eat breakfast. Breakfast, you can eat breakfast, but it should be at least 1 to 2 hours after. Because melatonin is high, melatonin has a direct effect on insulin, interfere with the insulin. Insulin resistance can develop. So at least wait for 1 to 2 hours before having breakfast, just after wake up. Then in the daytime, at least 30 minutes of activity during the daylight. Sunlight is very important, not only for vitamin D, but also for other things. Sunlight is very important. And you can maintain that time restricted eating, say 8 hours, 10 hours, 11 hours, depending upon your require. You do not keep on eating always. Your body, your physiologically, evolutionary, we are not designed to eat every time. There should be some gap. That is very important. And before the bedtime, don't eat 2 to 3 hours before the bedtime. You give some rest to your GIT. Otherwise, how can you sleep? So some rest has to be given, and at least 6 to 7 hours, at least 7 hours. For athlete, we say 9 hours of bed rest should be done. For that, you have to go in the bed for 8 hours. 8 hours. If you remain in the bed for 8 hours, then say 7 hours you can sleep. So this is the concept which we have to follow in holistic manner. So thank you very much. So what the point which I want to say is physical activity, exercise, and positive lifestyle. Very important. Why this is important? It will cause us positive physiological adaptation. And this positive physiological adaptation is important for 2 things. The first one is human performance optimization, number 1. Number 2, sports performance optimization. So sports as well as fitness for overall health, the physiological adaptation is important, and for the physiological intervention in the form of exercise, in the form of sleep, in the form of nutrition is very important. Just see this lady, she is the oldest competitive female bodybuilder, 74 years old. How she is maintaining her lifestyle. Thank you very much.
Thank you, Dr. Hanjumam Varun Sharma, for excellent talk on the exercise to prevent and treat effectively the modern diseases like diabetes, hypertension, and mental disorders. Yeah, definitely as an orthopedic surgeon, I also recommend exercise to improve the bone strength. Not only the bone strength, the muscle strength. If the muscles and bones are weak, there is a high chance of getting fractures. So definitely we should follow that. To prevent the modern lifestyle diseases, exercise is must. But I see most of the time here, most of the PGs, they use the motorbike to reach the hospital. Hardly 2 minutes walk. That also they don't do. And how can you maintain their health? I have seen that many are so obese, but they go on motorbike. So they can't maintain the good health. Thank you.
Thank you, sir. Now I would request the audience, do you have any questions on this session? Online, do you have any questions? Anyone? Okay, please.
Sir, sir, what is the exercise regime one should follow if they follow any regime of fasting? Fasting.
See, fasting exercise regimen, two, three things you have to understand. Number one, fasting should not be into starvation. The moment your muscle mass loss, that becomes starvation, not fasting. Number one. Number two, for what type of exercise you want to do in fasting, you can do depending upon your fitness level. You can do aerobic exercise. You always start with aerobic exercise. Aerobic exercise is the main core fitness body. Then you can do strength training also, depending upon your requirement. But depends upon your fitness level. So fitness level during the fasting, like for example, some literature are there which says that if you do fasting, cycling, or say aerobic exercise, by skipping the breakfast, then there will be more burning of fat. But if you see the overall picture of the fat reduction, that may be comparable whether you take, breakfast or not. That is also there. So some literature is also supportive, some literature are not supportive. But the point is, your fasting, what type of exercise you have to do, it depends upon your fitness level. Okay. Thank you. Sure. The Kunal sir को मैं हाँ अच्छा YouTube में वाले okay. Yes. See, fasting, definition of fasting varies different. Like for example, time restricted eating. People are following intermittent fasting. They can do, say, the 16-hour of fasting, 18-hour fasting, 2 days fasting, OMAD, 1 day fasting is also there. So depending upon a type of the fasting, it is also there. But the point is, you should not go beyond, what is not required of your body. That you have to understand your fitness. The best judge is you yourself. You have to understand.
You said that for diabetes, one type of exercise is preferable, and for hypertension, the other type. Most of the time, we see the person who is having diabetes also having hypertension. So, what is your recommendation about that?
Absolutely. Literature says that one type of exercise is not preferable on another. It is combination of exercise. Like for example, the last slide which I show is regarding the hypertension. When they compare with different type of exercise, they found isometric exercise to be more better. That is for hypertension. For diabetes, always combination exercise is very important. Aerobic exercise is important for insulin sensitivity. It increase the AMPK kinase. That means GLUT4. That means, non-insulin dependent GLUT4 translocation is increased by your exercise, aerobic exercise. Resistance exercise is important because it builds up the muscle mass. 80% of your glucose after your fit postprandial glucose, kahan jata hai? Muscle. If you don't have the muscle, then where will it go? So muscle mass is also important. Muscle mass can only come by resistance exercise. Aerobic exercise doesn't fill the muscle mass. It builds only your cardiovascular health. Resistance exercise has to be there. A combination of exercise is preferable for type 2 diabetic patient. For hypertension, also combination of exercise. So combination of exercise, concurrent training, it is preferable and should be done.
Thank you, sir.
I would now request Chairperson Sir Dr. Papa Naik to felicitate the speaker by giving mementos and certificate. Kushi, please come. I'd like to now call upon on the stage Professor and HOD Physiology, Professor Dr. Maloy Bikash Mondal sir, to come on the stage and to give a token of gratitude to the chairperson sir. Thank you, sir.
Thank you, sir.